I'm Susan England, and I'm the director of the nursing program. And just to tell you a little bit about the nursing program, we are a bi-level program, meaning we have a level 1 and we have a level 2 program. Level 1 can serve as the first year to that second year of the program. Level 1, the practical nursing program, is oftentimes what we refer it to, and it's a 10-month program. You start in August and you conclude that program in June. And at the end of that first year, then you are eligible to sit for your LPN board. See, we do not require you to do so. It's not contingent to moving on to the level 2 portion or that second year, but we really highly encourage you to go ahead and do that for many reasons. If you've become a CNA or a CMA and you've worked during that first year of the nursing program, that provides you that opportunity of a wealth of experience. Well, the same holds true then after that first year. If you test for your LPN, then you can work in that second year as well, and that helps you get, with your knowledge as you move through the program. The level 2 associate degree RN, you will be eligible to sit for your NCLEX at the end of the completion of the 2 years, and it's required by the Kansas State Board of Nursing. You do need to complete general education requirements for level 1 and level 2. Prerequisites before you can ever enter into level 1 is English Comp 1, general psychology, and anatomy and physiology. Anatomy and physiology is offered at Seward in 2 separate components. You can take a 5-credit-hour A&P, or you can take a 4-credit-hour anatomy and a 4-credit-hour physiology separately. Kansas State Board of Nursing will recognize 5 to 8 credit hours. If you choose to go on to get a bachelor's degree in nursing, I highly recommend that you take the 8 credit hours, just because oftentimes the BSN programs will require 8 credit hours, so that way you just don't have to retake some of the classes. Co-requisites, meaning that you can take them while you're in the nursing program, okay? The ones that you do need to complete that first year for the nursing would be that developmental psychology and your nutrition. Go ahead and get those out of the way, but then you can go ahead and complete microbiology, your Comp 2, or speech that later on in the second semester, or that first semester of your RN year. I don't recommend that you wait and put it off, just because it's a little more difficult to go ahead and complete those courses while you are in the nursing program. It is usually better if you can complete them all before you enter any of the allied health programs, if you're looking at your general education. Okay, I will turn it back over to Dr. Campbell.
A phlebotomy program, so everybody's probably had their blood drawn, right? So either they took it from your vein in the crook of your elbow, or maybe they did a finger stick, okay? Those individuals oftentimes are phlebotomists, and that's what their primary role is, collection of blood samples. So that's oftentimes the individual that you will see that's associated with medical laboratory technology or medical laboratory science. So you can do phlebotomy 2 ways through Seward County. We have an online phlebotomy course that has a lab component that you all live close enough that you would come 1 day a month and do lab, and you would get a couple of venipunctures and some dermal punctures experience you would have to check off to be competent in the course, and then oftentimes you can go to work with just that course. Not all facilities require you to be formally trained nor to be certified. However, we do also offer a certificate, which is 12 credit hours. So medical terminology, which is lecture only, the phlebotomy lecture lab that I've already mentioned, the introduction to medical technology, because oftentimes phlebotomy duties and functions cross over with what we call a clinical laboratory assistant. So knowing a little more about specimen delivery and what department performs what testing, answering the phone, routing the calls, those sorts of things, safety, lab math, all of that's taught in the Introduction to Medical Technology course. That is also an online course with a monthly lab. That's 10 credit hours. And then if you're working towards gaining your certification in phlebotomy, there is a 120-hour clinical practicum that needs to be done. So within that 120 hours, you need to have 100 successful venipunctures. And just as Susan mentioned, you do have to be 18. So most of the time, it's the minimum on the age, not the maximum. And that's due to liability within the facility. So oftentimes we will have students that will start and do phlebotomy, again, very much like CNA, CMA, and then into an associate degree or bachelor's degree in nursing. Phlebotomists oftentimes will start there and then migrate towards a 2-year associate's degree in medical laboratory technology. So we are the behind the scenes people. The only time you're going to see me is if I am your phlebotomist. If I'm the one that's meeting you as an outpatient or you're hospitalized and I'm going to your bedside to draw a blood sample. Our primary role as medical laboratory professionals is only the analytical part. So any blood or type of fluid that comes out of your body, we do all of the analytical part of that. So if the physician orders a complete blood count, right now we're doing COVID testing like crazy, whether it's the rapid or the more sophisticated polymerase chain reaction. If you're a diabetic and you need to be diagnosed, we're doing the glucose. If your family member's in the emergency room with chest pain, we're the one that is analyzing the blood sample for cardiac damage, those sorts of things. So we are very much like the nursing program, where the first year of the program is primarily general education courses. You'll see commonalities amongst all of our allied health programs. Anatomy and physiology, the English composition 1 for sure across the board. We do require an algebra class, so intermediate algebra. We also require college chemistry. The microbiology is common as well. And then we actually specify public speaking as your other communication for that. So this is our first year course list. And then you will actually apply. So one of the things that maybe we'll wrap up with is the application period. So most of you are already current students, so you've applied for admission to the college, but there's a program-specific admission for the 4 areas that result in the associate's degree. So we'll kind of we'll circle back around to that in the end. So I'm going to turn surgical technology over to Ms. Lexi.
Okay, let's start with a little background on what surgical technology actually is. Contrary to popular public belief, not everybody that works in surgery is a nurse or a doctor. Surgical technologists are specifically trained to work in the OR and are educated knowledge based on surgical procedures specifically. Our program is a 2-year program. Again, the first year being your gen ed course requirements. We have fall labs on campus. We are considered a hybrid program, so your lecture courses will be online with fall lab, where we will teach you all the specifics to make you safe at clinical sites as far as patient safety and setting up sterile fields. Spring clinicals are 2 days a week, where we go to hospitals, Southwest Kansas, sometimes in Oklahoma. We're looking at another clinical site in Texas. And then in the summer, we are going to vamp up to 3 days a week. We have to get you guys 120 cases, so it's pretty intense. Like I said, we have clinical sites all over Southwest Kansas, so we try to get students in at Wichita at the end of the summer program or summer semester, just to get a little bit more experience on cases that we probably won't see around here. Which one is it?
Middle one.
There we go. So your first year is going to consist of your prereqs, which again, anatomy and physiology, medical terminology, microbiology. We require 2 courses for communications, so English Comp 1 or English Comp English Comp 1, and then English Comp 2 or public speaking. We also require 9 credit hours of general electives. So sterile processing and distribution. This essentially are the healthcare occupationalists that work directly cleaning, disinfecting patient care equipment. Also, they work with surgical instrumentation. They'll clean, decontaminate, sterilize, and then redistribute to areas of the hospital. Places where you can be employed: surgical centers, hospitals, laboratories, and other facilities. Dental offices sometimes will do their own. This course is a 1-semester course. It is, again, hybrid. Your lecture material will be online. We require 135 hours of clinical experience at your preferred clinical location. At the end of the program, or at the end of the semester, you can sit for your examination and be a certified sterile processing and distribution technician.
I guess that leaves it to me. Again, I'm Janae Zachary. I'm the Program Director for Respiratory Therapy. So because of COVID-19, I'm sure a lot more of you probably have more of an idea of what we do. We take care of patients with respiratory diseases and illnesses. A lot of times our roles in the hospital are doing different types of therapies. We can do oxygen therapy, we can do non-invasive and invasive mechanical ventilation to help patients actually breathe. And then we do a lot of stuff to help inflate the lungs or open up the lungs and also clear the lungs of any mucus or sputum or infection. So our program is a 2-year degree. It's an Associate of Applied Science degree in Respiratory Therapy. And I've kind of already said what's on the slide, so I'm not going to necessarily read it to you. One thing that I do like about respiratory therapy is that we get to work in all areas of the hospital. A lot of times with other careers in the healthcare field, you work in a certain department all the time. And as far as working in one department, you're going to work anywhere from working with babies to geriatric patients or your older patients. And you could work anywhere in the hospital throughout one day. Now, when you get into bigger hospitals, they may assign you a certain area for that week that you're working. So usually 3 12-hour shifts is full time for healthcare professionals. So then you're going to be assigned to that one area so you can take care of the same patient for multiple days. But a lot of times in these smaller hospitals, you'll have your scheduled therapies, but then you're also going to be able to carry around a pager or a phone, and wherever you're called to, then you're going to go to that area and help them as they need you. Other places that you might work, ER, you're going to go into also any kind of high-risk deliveries or cesarean sections. Anytime that they may need to resuscitate a patient, we have to be present. Clinical rotations. So they talked about in other programs that they do local and Southwest Kansas region. We try to do that, but at most of our hospitals around here, there's only 2 therapists for the entire hospital on shift at a time. So we can't send all of our students to one place to follow 2 people around. So we try to get you where you have 1 student per 1 respiratory therapist, so then we use multiple sites every week. We have 15 sites that we use throughout your time in the program. For the first 2 semesters, you're only going to be going to the local areas as far as Hayes and Pratt, but those are still considered some of our smaller hospitals. And then as you move through the program and start learning more about critical care patients, then you'll start moving into those types of areas, which will be in Amarillo and Wichita. And then the final semester is in Lubbock, Texas, Wichita, or Oklahoma City, and the student gets to decide where they want to go. Now, of course, it's not paid because it's still part of your clinicals, but we usually have to go that far away so that you're guaranteed to see critical care patients of all kinds every single day that you're there. So courses that you need, again, we all kind of follow some of the same courses and requirements. So you're going to need your anatomy and physiology, your composition 1, You have a choice between Composition 2 or public speaking. You need to at least have intermediate algebra, but you can have college algebra as well. You need to do college chemistry, microbiology, and general psychology. Now, the courses that you can take while you're in the program is either chemistry or microbiology, so you have to have one of those completed prior to the program. You can take general psychology and Comp 2 or public speaking while you're in the program. For these prerequisite courses, we do like to see a 2.5 GPA. The reason we require this is because we do see that the students are more prepared for the rigor of the program. Now, that's not a 2.5 GPA overall, that's just 2.5 GPA for the prerequisite courses. And we feel like that sets up students for better success and retention within the program. I think that was it for me. This does say contact your high school counselor, but most of you, I think, are not in high school anymore. So then you would just contact us, each one of us, as we've introduced ourselves. And if you've forgotten who we are, make sure you can go with Magda, our Allied Health Secretary, and she'll direct you to the right person for whatever you're interested in.